Thank you so much, Jacqueline. This is really exciting to be here with all of you and with Stephanie. Because we have only limited time, we're going to get started. The first thing that we're going to do, we decided, is to show you guys a video, which will be a sort of a 6-minute presentation that kind of dives deep into the big picture of Kinnected. We felt like that would be better than a slideshow. And then after that, we would be happy to answer questions, philosophize, percolate on thoughts and ideas, and talk about how and why we can help each other and support each other in health innovation. So without further ado, I am going to try to work the technology and share my screen without messing things up too badly.
Megan, can I ask for a moment that you just speak a little bit more loudly? Lizette is.
Sure. Yes, I seem to be having trouble with my Zoom microphone. It's rather soft today. So tell me every time that happens that I sort of start to go off into a soft place. I'm a naturally soft-voiced person. So here we go. I am going to get this bigger and there. I'm Kinnected, and I'm excited to. I'm going to start that over. Hi, I'm Megan Haas from Kinnected, and I'm excited to tell you a little bit about our platform. Kinnected was really conceived 18 years ago as an antidote to a future zeitgeist when it would be critical to prioritize the health of human behavior and thus the health of our planet. So we are now living in that moment, a time when pain and injury are being inflicted on the kinetic global body. Our ethical behaviors are fractured, violence against others is normalized. Every day our apps are being made quicker, more reactive, and more humanoid. But it isn't the technology that needs to become more human. It's us, the humans. Health and fitness apps abound, but they can't unify us in separation from loved ones or brainstorm the health of aging relatives, nor offer empathy to overburdened health professionals burnt out from fractured systems and demanding patient populations. Health and social technology companies are limited, and ultimately they often work for their investors. So if the health of humanity is failing, then we need a global response towards repair. Kinnected's mission is to offer a free and diverse public health community that nurtures and supports all people and health professionals equitably. Kinnected's platform was conceived with the forethought that health technologies must adapt to us emotionally and socially, not vice versa. That next level platforms must be sustainable and create a common ethical culture. That we must move beyond appeals to the ego. Our features address how complex, non-clinical, social, physical, and especially in light of this last year, our emotional and mental health needs must be addressed meaningfully in a peer-to-peer setting at a time when people on platforms find it incredibly difficult to separate truth from misinformation. Our approach is to build a functional road to self-advocacy. Our entire suite of communication tools are developed to encourage open, transparent, co-managed, and supportive care. These features are built to combat what now characterizes lives of disconnect and superficial encounters, individuals and nuclear households that are separated from extended kin, health resources that are generalized and reactionary and incentivized, and resistance to medical pluralism. We're not taking on the health system. We are not disrupting it. We're flowing with it by building in parallel a global infrastructure to support what the health system can't and won't. We ask for a significant cultural investment from our members, and in return, they're guided ethically and warmly through the platform, like they would be by a welcoming host. Everyone's online, that's a given. So On Connected, we want our members to relearn how and why they are online by keeping things simple and creative, by stepping back into themselves, by telling their story in a way that can be silently witnessed. Our conversation feature has been developed to maximize good behavior and to educate and evolve better cultural understanding. Conversations are always one on one, unconnected, and focused on security and safety. We have no groups, no forums, no triangulation or audiences. Post COVID syndrome is serving to shine a spotlight on people who are experiencing chronic conditions and have been overlooked or dismissed due to the emotional support required. This helps Connected illuminate the many other conditions and communities that need to bring their non-clinical health into a cohesive whole. The infrastructure that people must assemble, usually alone, to maintain health. Searching for peers, looking often in vain for safe, stable social networks, or engaging in hopeful personal research. Now, this can be achieved in one place, autonomously, or through one of our wellness studies, which guide people toward a sanctuary space for post-COVID syndrome and other chronic health conditions. Connected's Reciprocity Project explores how to connect people across generations. We feel that the road to abating loneliness and building a more inclusive society is to innovate how the knowledge and history of our elder populations can play a more cogent role in the global health community. The Reciprocity Project builds health bridges between elders and young adults by encouraging active listening, establishing root systems, and bringing together cross-cultural and intergenerational groups to talk, examine, and collaborate about their health journeys. Years before COVID-19 struck, Connected was already being developed to balance the heavily weighted coin that is people's disenfranchisement from the health system and the need to support unreasonable demands upon health professionals. Connected's Global Health Directory brings together a community of health professionals from all over the world whose study, innovation, and practice places a priority on improving health and achieving health equity. On Connected, colleagues and peers all over the world can come together to build resilience, collaborate, and reinforce their purpose of caring for others. Connected is social repair on a foundational level. There is literally no better moment for a kinetic health system that works across countries and cultures based on values that we all share in our lives, hearts, and families.
So, thank you all for taking the time to listen to that. As you can see, we are all about nurturing both people and health professionals, and our initiatives and our projects have led to creating this whole health values-led system that we work very hard to anchor into other systems that are clinical, because we are clearly non-clinical. And these other clinical systems often don't have a social or a cultural pathway to bring people together into community. So Connected is really all about trying to find ways to bring health community together. If anybody has any questions about what they just saw, please ask away. Otherwise, we will turn it back to Jacqueline for whatever's next on the program in terms of questions that she wants to ask us.
Sure. So Megan, you have two initiatives that you've told me about. One is the Reciprocity Project and the other is the Wellness Study. Could you maybe highlight some information about those?
Yeah, I'll just say a little tiny something about the Wellness Study, and then Stephanie can take over that. We are, in fact, supporting two projects. One is around COVID-19, long haul COVID and chronic conditions. That is for organizations and clinicians, and we are looking for global partners for that, individuals and organizations. And then the Reciprocity Project is really, it's a framework that is for meaningful social inclusion, connecting elders and senior citizens to adults from generations X, Y, and Z to explore and share connection and knowledge relating to social, emotional, and physical health narratives. So these are weekly Zoom groups that happen every Tuesday. Up to 8 people can join, and we facilitate a discussion that revolves around questions about about life and health wisdom. Questions such as, what is unique about your body, mind, and spirit? What have you found is true and consistent in your health? What would you still like to learn? All these questions, echo the profile that we ask people to make on Kinnected. Even though it's a separate initiative, it's really, about what is your health story? What can you offer to other people? What have you lived through? And then the hardest one for people is, what do you want help with? Having brought so many people through the site, people get stuck on that all the time. People have been told their whole life not to ask for help. um, Women especially have really sort of, we sit and talk about this while I am bringing them into the site, and I hear the stories about the mothers who said, you have to be strong and independent, never ask for help. The men who said you're needy, all these things. So breaking down sort of those barriers around asking for help is super important when it comes to health. And I think it's one of that rugged individualism really bites us in the where sometimes. So the Reciprocity Project is it's mostly a reaction against what happened last year with elders. It was appalling to me what was going on with the loneliness, the nursing homes, the death, the separation, everything. So I wanted to create something really quick, really easy that would pivot into this year should we be facing something similar. So this is a place where any elder, any younger, elders can bring youngers, youngers can bring elders, can come together. And I have created a facilitated game around this that makes sure that everybody is part of the conversation. So even if you don't want to talk, you can say, I heard this, but I don't have anything to add, but I applaud what you just said. Or you can say, I'd like to hear more about what you just said. Or you can say, I had a similar experience and I'd like to share that. So there's always a way to speak or just witness, but you're observed when you're witnessing. So what we're working on right now with the Reciprocity Project is to get that out to as many elder communities as possible and as many universities as possible, so that we can get the youngers and the olders, together. There's a Calendly link on our site on that page, and anyone can sign up. There's 8 spots every Tuesday, and they're really deep, really in depth. There's been laughter, tears. It's just, I've seen 20-year-olds really open the eyes of 80-year-olds, and 70-year-olds open the eyes of 30-year-olds. So it's a wonderful thing that we're trying to bring and spread to as many organizations as possible. So that's the Reciprocity Project, and a lot of it is around asking for help or just discovering help. And then afterwards, we do say it, now that we've examined these thoughts and talked about what it means to ask and what it means to receive, and what our stories are, you can do this on Kinnected. You can create a profile, you can reach out to other people, you can say what you want, but it's not something that we push. It's just that the peer-to-peer support platform is a tool that is there to support anything be above and beyond. So that's one of our initiatives going into the winter. And Stephanie, please go ahead and let people know about our study.
Yeah, for sure. Thanks. The value of peer support is a key tenet and value of Kinnected. And so we want to work with COVID long haulers and other chronic health condition populations to test the power of peer support. There's data out there that says peer support really works for like addiction counseling and other substance use disorders. And we also know that it helps just in general in life to have good peer support. So the idea, Suzanne Morrissey and Sarah Little and I are the research team. The two of them are from Whitman College in Walla Walla, Washington. And Suzanne has long been a medical anthropologist in the faculty position. I've long been a medical anthropologist in my work within hospitals, basically to make sure that we're listening to the voice of patients and families and key stakeholders in the work. So this study is meant to track the symptoms that people are experiencing for whatever chronic illness they have. So fibromyalgia would be chronic pain, COVID long haulers. So track your symptoms. How are you coping with those symptoms? What are the interactions that you're trying and testing? Track those over time so you can start to see patterns in what works and what doesn't and what you might try. And then to really lean on others who have similar illnesses. And that, so there's 3 cohorts. There's one cohort that just has the personal narrative tool and are told to, try whatever they want to try. Then there's 2 cohorts that are specifically going to be on the Kinnected platform and are going to be encouraged to use. So one cohort will be specifically directed to use Kinnected in a specific way. And then the other one will just be told to use Kinnected. So the idea is then at the end of the study, we will have some real good evidence around what is the power of personal narratives, what is the power of peer support, and how does that play out in especially these, Suzanne named them elusive maladies. So these illnesses that don't necessarily get attended to in the way they should because people don't know what to do with them. I'm on Clubhouse, which is another social media platform that I just I'm trying to love, but I don't think I do. but I go every once in a while because there's this patient advocate who is hosts a COVID long hauler conversation every Monday morning. And it is, I would say, heartbreaking, really, to understand. I mean, and I don't think it's dissimilar from the people that I worked with at Seattle Children's when I was working there with the parents who had to drive over the mountains or the parents who had to take 4 buses or, the whole rearrangement of your life to get the kind of care that you're so desperate for that 10 minutes that you're in the clinic. But all that it takes you to get there. And so I think that there's been a lack of attention paid to these elusive maladies, and we're really trying to make a difference in that space.
Awesome. Thank you both, Megan and Stephanie. You've shared a lot of information, so I'd like to open this up these last few minutes for some questions. Are there any from our audience?
Hi, I too have one. Thanks for sharing that. That was a wonderful presentation. How do you balance the importance of peer support with trying to also combat misinformation? Because, sometimes what works for one person, they're sharing anecdotal stories and it's not really evidence-based. And so knowing that that's a really valuable interaction, but that there's a risk of sharing something that may be inaccurate or some sort of other misinformation. How do you balance that?
There's community guidelines on Kinnected for people to understand that they're not talking with health professionals, they're talking with people who have their own experience. So I think that you always go for, if you have medical advice that you want to decide, you can go to your provider, and it's okay to hear what the options are. I think that a lot of people don't know what the options are because their provider might not tell them. So I think that it is a bit incumbent on people to decide what they believe and what they don't believe, and to make that judgment call themselves.
However, that being said, we have, as my view is, there is no security online at all. The only thing that you can do as a person and as somebody who's running a platform is to respond as fast as you can to any misinformation and put as many safeguards into the development of the technology. So the benefit of Kinnected is that it is completely custom made. I fund it entirely myself. It is, it has been developed with a city planner. The the technology is created around common sense and intuition, but also the fact that we have no forums, the fact that we have no groups, was our first, the first pathway towards eliminating at least 50% of trolls. We also have a troll cave so that they can go there. It's at the bottom of the footer if you're curious. Really do. But this question is asked every once in a while, and we have flagging systems. We will have blocking systems soon. Um, Again, everything about the platform is really made to inspire hope, warmth, love, guidance. Um, we hope that along with the community guidelines, which you can access all over the site, that people will join accordingly. And like it says in the video, it truly is an investment. You'd have to have somebody who goes on there and spends a whole bunch of time surrounded by art in the very beginning of their sign up process. They have to put in a quote, and they have to put in their story and what they offer and what they don't. And very soon, people who after a week haven't done that will immediately go private. We will make them go private. So, the most we can do besides keeping URLs out of those places is, is be on top of anything and everything, and continue to be lucky enough to be flexible enough to pivot to whatever we need to. But yeah, we do what we can, and also it all goes straight back to me, and everything that that I feel about that comes from a pretty substantial source of truth inside. So if the right thing needs to be done, the right thing is going to get done. We're not looking at other platforms to do it their way. We are doing it in line with all of our values. So there's a long-winded answer for you.
Thank you, Megan. So, we are about to wrap up our presentation time, but I wanted, before you leave today, I'd like to say a big thank you. I think you see a like-minded individuals here. You clearly have been out trying to improve the world and trying to make the world a better place through helping people better understand their health histories and their resources. Stephanie and Megan, what can Health Tie and the Health Tie community do for you?
Well, the site is made up of quadrants, and we need help in those quadrants. We are always looking for members who are wanting to share their story. We're always looking for health professionals, which is our revenue model. We have a very simple, elegant revenue model of health professionals from all areas of the health community. So innovators, stakeholders, hospital admin, providers, recently graduated students, hospice, bereavement, everybody is welcome. And so any kind of organizations that might want their practitioners to join a very community-oriented platform, or solo practitioners who are looking for a little bit more visibility. And then we're also looking for elder care organizations, social orgs, or student organizations who work with volunteers to come and be part of the Reciprocity Project. And then there is our study, which Stephanie can again talk about what she
So that would just be patient populations or people who are running long COVID clinics.
Thank you so much. Well, it's been a true pleasure to have you here today. And we look forward to staying connected to Kinnected. So do stay in touch with us. What typically happens after these meetings is we get very excited and talk more about what you've developed and send some questions. I usually do some email introductions. So I invite anybody who'd like to learn more or to have an introduction to Megan and to Stephanie to email me, and I'll be sure to share that. And do you have any upcoming events or anything you'd like to let us know more about, or any place that we should see you on Facebook or LinkedIn?
No, we fly pretty under the radar until until we're ready. So we're taking things slow at the moment, but thank you.
Okay, awesome. Well, thank you so much for joining us here today, Megan and Stephanie, and we wish you great success in your endeavor. It's really a thoughtful, important piece to the healthcare environment, and thank you.